is the only FDA-approved 5 years and beyond filler. The two other biostimulant products on the market is one Sculptra, the other is Restylane. Those two products give you anywhere from 18 months, 2 years, somewhere in that. Bellafill is the only 5 years and beyond. The way that I explain Bellafill to patients who are not in the medical profession is this. If you are thinking about bringing your own collagen stimulation back up, within a Bellafill syringe there are two ingredients. There is temporary collagen and a microscopic film of PMMA. If you've ever heard of somebody having a knee replacement, a hip replacement, perhaps cataract surgery, all of those have been coated in PMMA and installed into the human body. What is this? Well, for all intents and purposes, it's surgical glue, polymethyl methacrylate. Now, within a hip replacement or a knee replacement, you're using a large quantity of PMMA. Within a syringe of Bellafill, you are actually talking about a microscopic film. It's invisible to the human eye. It's smaller than a red blood cell count. So what we're doing is we are sending in that temporary collagen, and what it's going to do is it's going to actually wake up your own collagen stimulation. It's setting off an alarm clock. That alarm clock is now going to wake up your own collagen supply and start rebuilding it on a multiple amount. It will then rise up and it will adhere to that microscopic film of PMMA. In approximately 30 to 40 days, the temporary collagen that we've installed is going to actually eliminate right out of the body, never to be seen again. All that will remain is an abundance of your own collagen supply and a microscopic film of PMMA. That's it. And that's why it becomes the most natural of all the fillers on the market. Am I going to look fake? Am I going to look like I'm a duck or a trout and have these big, humongous, fat cheeks? The answer is no. The reason why I say no is because it is the most natural of all the fillers. This is really not a product that can augment, that can change your facial structure. This is basically going to fill the volume that has been robbed of time, basically. So as we age and we start losing the fat pad around our temple region, as we lose the zygomatic bone structure, as we start getting the puppy dog jowls, all of that is an aging process. I always say as we age, our face is like an avalanche effect. This drops and this drops. When I start speaking with somebody about their nasolabial fold correction, this is actually the effect. This is not the cause of the problem.
So I equated, this is how I always explain it to my clients with any of the fillers. Per decade, we basically lose one syringe of filler per decade. So if you're in your 30s, there's a probability that you could need 3, 40s, 4, going up in that way. If we are spot treating, so as opposed to correcting the cause of the problem and just looking to correct the area, it is always a little different. So, and consultations are free, which is nice because it gives us time to kind of create a game plan so you're not completely overwhelmed and feeling that you necessarily need 4 syringes.